Start straight.
All right, we're live.
Okay, we will call the meeting to order. It is Tuesday, April 11th, 2023. Please stand for the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Born and
Okay. Do you have any minutes and reports received and filed?
Yes, the sheriff's March fees and the auditor's March fees.
Okay. Commissioner Committee liaison reports, upcoming meetings and events.
We've got a meeting after this meeting for our central maintenance. Got a MAC board meeting this afternoon, got an HBA board meeting this afternoon. They've got to meet with this new superintendent for Blair Oaks High School in Meldrum today from 4 to 6, I think. Planning Grand Management District Board meeting tomorrow afternoon, HBA meeting tomorrow evening. There's a Harlem Wizards versus I've just got Yemby team as some local.
Yeah, and Luke Holtschneider's playing.
One I'm playing.
Yeah.
It's at Elias. I think that'd be a good time to go watch that too. I got some other stuff going on, but I think that's at 7 at Elias. Chiefs have a meeting Thursday evening. We got a coffee club meeting Friday morning. There's a reception for Mayor Turgeon Friday afternoon, I think 2 to 4.
Uh-huh.
I think that's about it.
My calendar shows MAC, Missouri Association of Counties, this afternoon, evening,
Yeah.
as well as tomorrow at the Capitol. Tomorrow, Wednesday, ARPA meeting here, Salute to America meeting at noon, Heartland meeting on Thursday, ARPA again on Thursday, Friday, what you mentioned about Mayor Turgeon, Monday, ARPA, and Monday, Safety Committee meeting.
Okay. Tomorrow at 2 p.m., AT&T and FirstNet are having a ceremony out at Hyde Park that we are all invited to, and the governor, lieutenant governor, and Congressman Luke DeMar will be there. Yeah, Harlem Wizards. Thursday is the 280th birthday of Thomas Jefferson. So the Sons of the American Revolution, Daughters of the American Revolution are having a ceremony down at City Hall at noon, if anybody would like to attend. Yeah, I got Friday, Mayor Turgeon reception. It is also the anniversary of the day Lincoln was shot at Ford's Theater. Saturday, the Sons of the American Revolution and Daughters of the American Revolution have their Patriots Day, and we will honor our local heroes. And then Monday, I got on my calendar, it's Jeff's birthday. Is Monday your birthday? And then I've got a Cap Region Foundation meeting, so.
Is it a holiday?
You can make it.
Paid holiday.
Anyway, and that is all I have. Any commission comments? Bids and contracts. Approval of an additional service agreement with Architects Alliance for the Pringer Family Center.
Can we pass that for a minute? Sorry.
Yes, ma'am, we may. How did the blood drive go yesterday, Chief?
Blood drive.
Since where?
Yes. So blood drive went fantastic yesterday. Good turnout from the community and our public safety partners. We ended up collecting 32 donations, separate donations. Obviously, some gave more than just one unit, so we don't have the final count back yet, but that's actually 2 more than what they had even scheduled for us, so we found a way to get 2 more people in. So it was a great turnout. I think a lot of people enjoyed it. The talk yesterday was that we already have a plan to double the size next year, so we'll keep that going and hopefully get more people out and go from there.
Who won the battle of the badge?
The ballots are still being tabulated, but I would say that it's looking good for EMS at this point.
Are you the one keeping score?
I'm not
Yeah,
keeping
boy.
score.
Well, maybe-
I'm not keeping
I
score.
learned that playing cards with Grandma. That's why
You
she
know, we
won
should
all
have
that.
had the election judges count those.
Oh, yeah,
Well,
we
they,
should.
it wouldn't have had time to do that. Never
Oh,
mind.
good. Glad it turned out well.
Yes, it was very
Yeah.
good. It was a
Nice job.
good highlight for program and service.
Okay,
Okay. On the Architects Alliance, this is an additional to the first letter from them was $16,500. This is for an additional $3,500. And so you just sign the bottom of that letter from them. So I can change the purchase order.
yes, ma'am.
But that's assuming there's gonna be more meetings on that property, right?
Well, there already has been, I guess, so this is to help pay for bills that have been. It still leaves you about $1,000 for more meetings, yes. Of
So it
$3,500.
includes a bill for the meeting in late March? I didn't think we had the meeting in late March. They decided they were not interested in getting rid of that property that we were talking about. So would that close this project out?
It was all one big project for them to help, and this was, what I understood was an additional stuff that they didn't know that they were getting into. Like
Yeah.
Going to meetings with you
Yeah,
guys and
and-
doing
yeah.
stuff with you guys.
Yeah, they were there. We're looking at other locations too,
Yeah,
so.
some of that stuff they
Yeah.
were planning on at the beginning.
Yeah.
So this is taking care of everything we've done related to that property.
And with 1,000, 1,500 extra in there for now.
Okay.
Extra for what? We're not gonna be talking about that property anymore. It's done.
Any other property, or any other thing architects.
So
want.
this is gonna be,
I think this, I mean, we won't finish work with architects until we have a location identified and.
Sure.
Yes.
I mean, whatever was drawn up for that other location, some of it's usable, some of it's not. I mean, I think this will continue until we've settled on a spot.
so this will be for other areas going
Well,
forward.
but I think there'll be more money asked for at some point. If we say, wait a minute, the ground that we've identified now is contoured differently, and therefore it's going to take a different design.
Yeah.
I think it's not that it's going to be an annuity for the architects, but it'll be a continuing source of revenue until we
I
say
think the
no.
letter, though, kind of framed it like it was just for this property, so I was making sure
Well,
that it was for,
Yeah, this letter is dated March the 14th, and it mentions the other presentation that was done back in December in 16.5 for that. And then in February, further steps were discussed, January, further steps. So there was about $2,400 identified in those additional meetings. And that there was a meeting planned for late March, which was not held. He does say we estimate totally our not to exceed 3,500 for our additional services to date, which includes the 2,400. I think so it's only about $1,000.
and to conclude these meetings, which sounded like it was just for this area. So are we closing this one out and then gonna start?
Yeah.
Or we're just gonna keep this going, and we'll, when we get through the 3,500, not to exceed,
Right now, they can't send us a bill for more than $3,500.
Right, and we have one for about the 2,400.
Right.
So right now, the 1,000 is basically all in, and
I-
otherwise they're gonna have to set an
So-
agreement.
I
When
think
we-
you've answered my question. This is not just for this lot, or this
Well, that's
parcel.
true because, I mean,
This is
some of their
all-
design is going to carry over to no matter where we go. Right, Toby?
Yes, so I.
I mean, it can, it's just the letter was kind of talking specifically about this parcel, this plat, this lot. So,
I think what he's explaining is how he itemized his bill, and then there's money left over to assess any other property that we present to them.
I want to make a motion, go ahead and sign the letter and agree to the $3,500 addition.
second.
All in favor?
Aye.
Aye. Okay. Do we have any unfinished business? New business accounts payable review.
I'd ask for approval of accounts payable. These are P cards, if you have yours in there. I moved yours to the next one.
Okay. I'll make a motion to approve accounts payable pending review.
Second.
All in favor?
Aye.
Aye. First reading of budget adjustment number 9.
This is for $63,710.22. This is the LEPC Nick T. Sword grant. Let me see. Yeah, LEPC LEPD grant. No action today. I'll bring it back up in 10 days.
Okay. Health Department salary discussion.
Good morning.
Good morning.
Good
morning.
So we've been talking about this for a while. As you know, we've had one nurse vacancy. Our immunization nurse position's been vacant since September, and then we've had another vacancy since December. And we're having a hard time getting qualified people to apply. And when Jen calls them, talk about the position, if they have applied and once they find out the salary, they typically decline. So for lack of better options, we've gone to appointment only, and we've been trying to figure out how to manage the duties we have with the staff we have and how to increase the salary without increased salary line in our budget. And our proposal is to eliminate what we call our public health nurse 1 and take some of the money from that position and divide it amongst the other staff and increase the salary position for that public health nurse 2 or 3, I guess. We're not married to those designations for 1, 2s, and 3s, but basically we have 2 nursing positions that have programs and work in the clinic, and then we have 2 nursing positions that have more complex programs. The immunization nurse and the communicable disease nurse have more complex programs, and they're also on call 24/7. So they deserve to be at a higher salary level than the other 2. So whether we call them entry level and senior, basic and advanced, 1s and 2s, really doesn't matter what we call them, but we basically have 2 different levels of nurse positions. So I did bring an org chart. I know that it's probably been a while since you've seen our org chart, and I circled the position that we want to eliminate. And then I sent the spreadsheet. I do have copies if you'd like to see it with the salaries and how it affects the current, the starting salary grids, which this is from, I sent this one to us from 2018. That the auditor's office had developed. Harry, for your background knowledge, when they implemented this grid, if people had, several years of experience, they went to that level, but people don't automatically move up once you get that level of experience. Does that make sense? When we implemented this, if you were a public health nurse 2 with 4 years of experience, you went to that level, 46,000 on the chart. But if you were a public health nurse 2 and you accrued, 3 years, and then you accrued 4 years of experience, you didn't automatically move up that $500. Correct, Debbie?
Right.
We didn't automatically move up.
Yeah.
That was just how they adjusted salaries in 2018.
And she kind of used this, but whatever you guys approved was just the starting salary for each one of those positions. But yes, this is what she used to try to get to that data for the starting salaries. But we never did do anything for years of service.
Okay.
After this.
Yeah.
Well, I had suggested this to Christie, eliminating 1, because that's what public administrator did, and I think it has worked out very well, and I think he's also compensating his people, for picking up more work, so
And our nurses have definitely been doing more since
Yeah.
December, or since September and December, since those positions were, so those people left, so,
In
and
the
it,
immunization position, you can't just, there are duties that have to be done every month, almost every day. You just, those are something that you can't
Not do.
let slide.
Yeah.
and Jen and Donna have been doing those, and we know Donna's, retirement is marked down on the calendar, so we really, really wanna get, at least, we wanna get the nurse 3 position filled, so when Donna retires later this year, I mean, it will create more vacancies, and we want to be able to provide the service, especially in the fall, and we going into all the flu clinics in the schools. Those are very important, and we want to be able to offer those services. So.
Yeah. I think it's really kind of a wash. I know our HR
Yeah,
director also said she, it's.
Right. I kind of did
it's-
my own mini salary study and compared, and Sheila was in agreement with the numbers that I proposed.
I think for right now, that pretty much solves our problems.
We hope that we can
Yeah.
get people to apply at that salary.
Yeah. And Donna, you work until, at the pleasure of the commission, until we let you retire.
Is that one of those things I signed?
Yeah,
that
yeah,
I was
yeah,
signing? Okay.
yeah. Yeah,
Randy might agree with you, but you know.
I've talked with Christie about this, and I think we do need to make some kind of adjustments to try to, I guess, recruit some help. I'm not all gung-ho about taking that whole position and divvying it up amongst all the other ones. Maybe take a few steps and see if we can increase it little by little. Some of the bigger movements was from the clinic manager, nursing manager. Those will go going up 7,000 each.
I gave that everyone, all the positions went up 7,000,
Right.
not just them.
And then we talked about the, trying to fix the grid, because right now we've got, some nurses, nurse 2 making. Luckily, Christie sent us a lot of information here trying to sell her proposal.
I got that for you.
That's
Since
what's in-
September, just a little back up, since September, we've received 8 resumes. That's all. We've had 2 positions. We've received 8 resumes since September. We interviewed 2 people. No. One of them was a possibility of coming back for a second interview. Well, we interviewed one, and we were gonna hire her. She didn't call us back for like 2 weeks, finally called us back and said it wasn't gonna work for her. Then we interviewed 2 people that were absolute no's. We interviewed a 4th person in, so to speak, and we're gonna bring her back for a second interview. She wouldn't call us back. And since then, we've had 2 or 3 more applications, and both of those all declined because of the salary. It was just gonna be too big of a cut. So,
And the other thing I'd like to point out is, when the 2023 budget was done, Mark put a reserve in everybody's budget, and I'm not even touching that. That reserve wherever that's in general, everybody had a designated thing. I'm not even touching that. This is what is in my current budget, and it'll actually go down, because when Donna retires, we'll hire the person in, at the new starting salary. So all in all, it's not really a wash. It's kind of still a deficit, because I'm not using all of the budget that was given to me in 2023, because we're eliminating that 45.5. We're only distributing 42.
So
And I'm
eliminating
not
the-
touching that reserve that Mark gave me.
Right, eliminating the position, I'm not arguing that point, but eliminating the position isn't necessarily helping us. We're still using all that money, and the other positions that we've eliminated before, and we've done it with the public administrator, we didn't take all of that position and divvy it up.
And I'm not
Same
touching the
with the-
benefits either. I mean,
Same with the
yeah.
recorder, when we did that with his, he didn't take all the money. We did give some raises in there when we eliminated the position, so.
when I started in 2012, we had 8 nurses. Then somebody retired a couple of years later, we filled that, and then when somebody else quit a little bit after that, we didn't fill that position. So then we went down to 7 nurses, and which was good, because we said we could do it. We didn't get any raise for doing that. We didn't take any extra money for doing that at that time. We just lost that nurse position. And now we are asking, because it is, adding more duties to me, you know, like, she's doing a whole nother job, I'm doing a whole nother job, because those are jobs that need to be done. It's not like we can just say, well, we won't do them. Immunizations are one of our biggest.
And it brings revenue
And it
in.
does bring
Well, we
revenue
talked
in.
about that too, Christie and I did. I said, what are some of the duties we can eliminate? Because we've got the community health center, that's also providing some of the stuff. What's some of the stuff that we can maybe eliminate and take the load off?
Unfortunately, it's the worksite wellness stuff that we do for our own employees.
That's one of them I said, we can get our own
Yeah.
apples and crackers.
Yeah, so we just, we don't get snacks anymore, and biometrics, instead of going to all the offices for biometrics, if they want it, they have to come to us,
And whenever I did the worksite wellness, there was maybe 20 people who participated in all that.
the lunch and learns, so.
I mean,
Oh, there's more than 20 on the zombie walk.
well, yes.
Yeah, that
was the only one that where we
Okay,
had
the only
good
one.
But we
Yeah,
we do the lunch and learns,
I
we
got
don't
caught
get.
up in that
yeah.
too. Thank
Well,
you.
we were talking about having one of the front desk staff do the Sam's ordering for the snacks. That doesn't need to be a nurse. So, we were trying to still think of ways we could do the duties and have other people do it, so we don't have to cut those services.
But so the other services, we have contracts for, so we don't want to eliminate those positions, because we're getting money for the CCHC and the MCH contracts. We don't want to eliminate those positions, and those
Okay,
are
that was
things
something we talked about too. Where can we increase revenue? We raise the prices on some of the stuff. Some of it is set by
Some of step by
state. I don't know if it's insurance companies or what. So,
Well, there's such a shortage of nurses everywhere. And it's not gonna get better. We always have nurses graduating, but, we have to do something. So, and to me, I think this is pretty savvy. I like it.
I'd still like to see something done with the grid where we had a nurse 1, 2, 3, maybe a nurse 2 senior or whatever, because there's just such differences in what they apparently do and the jobs and duties that they have. And, I looked at all the information you gave me, and yeah, we're not gonna match what
We had
the other ones are gonna.
we had a big discussion about that, and it seems like on the work chart, if you look at the CD, EPI coordinator, and the immunization coordinator, those level of duties and responsibility of being on call 24/7 are pretty equal. And then the PH nurse, STD coordinator, PH nurse, MCH, CC, HC, and FP coordinator, those two are pretty equal. So we kind of have two levels. So like we said, if we call them 1s and 2s, based on the nomenclature, I don't think anybody's gonna have a real heartburn about what we call them, but we don't really have a 1, 2, 3, 4. We have 2 that are at this level and 2 that are at this level.
And we could have somebody coming in starting for a position. We have a starting salary based on the position, not based on their experience. We could have somebody coming in with 2 years of experience. We're gonna start her at the same amount, her or him at the same amount as we start somebody who has 5, 6, 10 years of experience. It doesn't really matter. The years of experience is not so, because that's a starting salary. So sometimes we're getting more experience, sometimes because of the start. We don't have any of that based on years of experience. None of that ever.
It's really based on the duties
The
of the
position,
position.
So that's why I'd like to see a grid, so that if somebody leaves, then we know where it's starting at.
Well, and I have that in the new starting salaries are in that chart I sent you. So the previous
I
grid,
gotta
we're
find
adding
which
this.
grid that is.
I know.
Like I said, you sent us a lot of information, a lot of good information.
And I think I had actually increased these two a little bit. I had rounded them up to 70 and 60, but the new starting salary for basically the
Okay,
ones.
that's where I came up
Yeah.
with the 7,500 on that
Right.
one. I was
For
confused.
the new starting ones, but for this one, it's just.
And in my position, the clinic manager, I'm her supervisor, Jen's supervisor, she supervises the nurses, but then I also supervise all the front office staff. So then, I'm kind of responsible for them as far as the billing goes, as far as all of that stuff goes too. So I know that there is a jump in salary there a little bit, but I've also been here a little bit longer than her, so I've gotten all of those
And the starting salaries, there's, yeah,
Yeah.
like I said,
There
my
is
chart I
there
sent
is
you,
a
I
difference, but
had made the
But
starting
that's why
salary
I need
70
the
and
grid,
60.
Cause I'm
Right.
working more with the grid, and then we can take and say, okay, here's why you're gonna get more than what this
Yeah.
new
Well, you know,
proposed
just-
grid is because of longevity or whatever. I'm not opposed to using some of the money for eliminating positions, I absolutely agree with that. I don't wanna give you additional duties, require more of you, and then say, hey, still pay the same thing. We wanna retain our employees and recruit some more. I'm just not sure I'm ready to do 7,000 each.
So the state starting salary for this position, basically the kind of the same position was what, 56,000?
But if we try to compete
It
with
was,
the state all the
but-
way across, we won't be able to afford it. We'll be
No,
broke
yeah, we
tomorrow.
can't, because they get to work from home, they start at 10 and 10 for leave instead of 8 and 10. They work, yeah, and they get 6 weeks paid maternity leave and paid paternity leave. We can't compete with that. Well, they just do programs, they don't do clinic services.
They
They'll-
work
so-
from home.
So, you know how we have like the MCH program that does like safe cribs and stuff? They have a program manager that supervises all the LPHAs throughout the state on that program. So, you know, they work from home a few days a week. I don't know how they do it, but they do. And we can't because we offer clinic services every day.
And none of these nurses are the grant.
So like a portion of the MCH, CCH nurse, a portion of her salary is paid by the MCH and CCHC contract. A portion of the STD nurse salary is paid for by the MCH contract. Immunizations, that's just billing for immunizations. The state doesn't give us any money for that. They give us free vaccines. The communicable disease and epi coordinator, that's part of the LPHA participation agreement that's woefully underfunded, where I always talk about how Missouri is last in the nation for public health funding on a per capita basis. That agreement pays for part of that salary and pays for our food inspections, on-site sewage complaints, lodging complaints, and all other communicable disease investigations. So that's why we're always campaigning the legislators for more general revenue. So yeah, the grid I sent you did have the starting salary for the clinic manager at 70 and the nursing manager at 60. I printed the wrong one. So that would be the grid that I would like to have approved for the new starting salaries.
So the 70, 60, 53, 53, 51, 51.
Correct,
That's what you want.
correct.
Okay. I guess when we eliminate a position, we eliminate the fringes for that position.
Correct.
Now, some of the fringes are just almost transferable, but one of them that does go away is the health insurance. So that's a $7,000 or $8,000 number, right? So, so this part of our organization would recognize a reduced health insurance cost of $7,000 or $8,000 per person. I mean, is that what it's coming into these days?
Yeah, 30,000 with all the other stuff too.
Okay.
Yeah, just the health, dental, and then the retirements.
But the
would be
retirement, I think, will kind of wash.
Right, because we'll have to pay extra on the ones that are here
Right.
because of the increase, yes.
Okay.
Yes, you're right. So are you talking
Um,
7,500 or are you talking 7,000 down the line?
This is the right chart. So just 75 for those two, 7 for the rest in the starting salaries. But for the what's current, wait.
Should be 43,000.
Only on the starting salaries. For the current, it's just 7. So this is right, 75, 75, 77. Does that make sense? I'm increasing the starting salaries by 75, but the current only by 7,000.
And basically getting rid of a nurse 1 and adding 7,000 to the nurse 2.
Correct.
So 7,000 plus 2, so 9,000 to the starting. Because you're
just-
getting rid of a 1. A 1 used to be 42.
Right, and I'm just taking that position in, well, it used to be, yeah. Right now, in the 2023 budget, it's 45.5.
Yeah.
This is from 2018, is the 42. From 2018 until now, it's been increased by $3,500.
So if it went from 45.5 to 51, that's a 4,500. But, yeah, you wanna increase the other one 7,000.
Right.
So the starting salary only changes by 4,500. But then the other ones would change by 7.
Well, actually, we're eliminating that position, so it's, yeah, so it's from 44 to 51. There's my,
Roughly, as we go down to the very last column with numbers in it, what's the, can you recite from memory or guess years of service as we would go down? Just go next to it.
well, the first position has 10 years.
Okay.
4,
Almost 4.
the next one, Jill has 4, Jill has 5, right?
She'll
No,
be
4.
She'll be 4 in May, she'll be 4 in September, Chad's gonna be 4 in July, and Megan will be 2.
So going down is 10, 4, 4,
4, 2. Yeah.
4, 2.
Well, the middle one, that 56.5, that's the vacant one.
Oh, okay.
Yeah.
So 10, 4, 4, 0, 4, 2.
Okay. Those folks that you've interviewed, are they coming in with that kind of experience? I mean, they've said no to you, but I'm just kind of getting the flavor of stuff.
And we really do need somebody with a little bit of experience. It doesn't have to be 5 years, 4 years, whatever. But they need, no, you're talking about years of experience here.
Yeah.
Their years of experience as a nurse are
way
are
Oh,
worth
well,
it.
that's what matters
I have
to me.
over 28 years. She's got.
Okay, let's start over. Start at the top and come down with, not just years
So-
with the county, years in the profession.
28.
Okay.
What's yours?
11.
How many Chesney?
Chesney's probably,
A little bit less than you, because she
Right.
graduated, so she's 29, she's
About 9.
7.
everything.
Yeah, well, she graduated when she was 22, and she's just 29, so
Okay.
7-ish.
And then that vacant position, and then Jill's.
Jill's probably 10, 12 or 13.
Probably, yeah.
And-
Megan's probably about 7.
Yeah, we stole her from the university.
Have you ever hired somebody right out of nursing school?
And that's what I was saying. we
Not
really-
usually.
It's really hard because we work under standing orders. So for a new nurse to come in to work under standing orders, they really need a little bit of experience and a little bit of those critical thinking skills on how to, even though we do we don't do a whole lot of clinicals, we do have some, and so you do need a nurse with a little bit of experience. I'm not even talking about years and years. If they have a year's experience, it would be good. They just need somebody who's worked in some place so that they can be organized, hospital, clinic, something that they can have their organizational skills down, some critical thinking skills.
Well, yeah,
And orders,
yeah.
understand standing orders.
And it seems like when nurses come out of school, they think, well, I want to work in a hospital. I want to save lives. I want to do all this stuff. So they go and they work in the hospital, or they help, work in the labor and delivery. And then in a few years, they have kids themselves, and they're like, I don't want to work nights and weekends and holidays. I'm willing to make a little less money so I can be home with my family every night and not have to work all those crazy hours. And then they come to work for us, right?
Yeah.
That's what happened with Jen.
Everybody.
Everybody that we have got tired of working nights, holidays, and weekends, so they're willing to take a little less money so they can be home with their family.
And at the time, it was a little less. Now it's just the gap has just grown.
What is the starting salary for a nurse at a hospital?
Will the,
Well, Jana's at work, Jana that used to, she's on at State Tech, and she said the companies coming and talking to them are in the 80 to 90 range. And I know that one of the nurses that Jen talked to on the phone was working at a Cap Region clinic setting, making 64. Right,
And they're closing clinics because they don't have staff.
right.
It's,
So, yeah, we can't compete we can't.
We're going to compete.
There's no way we'll compete with hospitals.
No. And we don't expect it, because they
No, I
have.
know, but I know that world has changed.
Yeah, but in a clinic,
I know.
64.
I mean, if you're a traveling
But
nurse.
we're providing a service because the state says to,
Yeah,
right?
well, some of it we're statutorily required to, like medical
Yeah.
disease
And
investigations.
So again, where's the money at for that? If we're required to do it,
Right.
why are they not?
We're lowest in the
supplementing
nation. The county, the states around us are at $10, $12 person per capita, and we're at like 5.
And then we're supposed to be able to compete with the state.
Right.
Well, and even the surrounding counties. think
And I sent that.
Christie sent that around too. The surrounding counties, their salaries were even higher than ours. The smaller counties are.
Which really works realistic security guard salary survey than anything else.
Well, Osage County, I think is 60, but
Right.
I don't know if they have just one or two RNs.
They only have.
Yeah, so.
I think,
And we do see a lot of people from other counties just because a lot of them don't offer all the services every day like we do. And, yeah, we don't care what county they're from, I don't care.
but we charge them an
Yes.
office fee, or we run
Right.
insurance for immunization, so we
Yes.
do bring in whatever revenue we can.
What, will the public notice a difference with this proposal?
No, they might actually, well, so right now, we're running appointment only, we'll keep that. But in the fall, when we go in to do the school flu clinics, we get so many parents and actually pediatricians that thank us because people don't have to take off work to go get their child out of school and schedule a doctor's appointment for their flu shot. So if we don't fill that immunization position and we have to cut some services because we don't have enough staff to go do those flu clinics, or we have to close our clinic at the office because we're going to do those flu clinics, people will see a reduction. But with eliminating this position and filling the one that we need, it's going to help us, not hurt us.
Okay. And the doors to the facility out there will be open the same number of hours?
Yes,
After if we would do this?
yes.
Okay.
See, right now, we've been doing appointment only, which is working really good. I think people are used to it. And then if they walk in and there's nurses available, they're seen, we don't turn people away unless we're just absolutely swamped and do not have anybody available.
Can't get mad about free stuff.
I think this is an ingenious way to hopefully get an RN and then keep our RNs.
You're losing one.
Well, we're losing
We're
an
a-
empty one, yeah.
Yeah, well,
Well, we can't keep doing the same thing, expect a different result. That's the definition
No.
of insanity. We have to try something different.
And it's not gonna cost the county any more money, basically.
Yeah.
It's not, and that's what we're, I know that,
Until a year or two, Christie decides to take a different job, new director comes
Oh.
in. Hey, I can't, it's too much work for my nurses, I need to hire another nurse, and then here we are again, and I gotta hire another nurse, but then
Well,
we've already got these salaries.
I
that we
guess
have
the
to
other
keep up with.
alternative is
So-
you just increase the budget we
there's-
have and we fill all the positions.
What we can do is work on it somewhat the way you're talking about, but I'm not talking about taking all that money. I'm talking about maybe doing it in steps somewhere. And so that's just my argument right now. I haven't heard the argument to jump them all up 7,000 each spot. To me,
By not filling
doesn't
those-
justify.
And if we increase the starting, I don't think it's fair to increase the starting salary for a new nurse and not rewards the ones that have been with us, especially the ones that have stuck through us through COVID.
That's where you get compression.
yeah.
Oh, shut up, compression boy.
Well,
Go sit down. You're not part
I
of
wanna-
Star
I wanna
No,
keep-
that's not. that's
I
not
wanna
even what I'm
keep Jen,
talking
I wanna
about
keep
right now.
Chesney, I
But
want
didn't
them
say not to
Yeah,
do
I
it.
wanna
to
keep
stay
the
with
ones-
us
yeah.
until they retire, as Donna is doing.
I didn't say anything about not.
Next year, maybe.
I did not say anything about not paying and retaining our current nursing staff, or to raising them some too.
My comment.
I did
was
not
more
say
what
anything bad
Christie
about it.
said, So I was agreeing with her, not against you, and against Floyd.
So, to
Didn't
fix the
even-
grid in the first place, and then there would be, because, and Christie and I talked about this for, I don't know, for a while. So, I don't know, if you two are gonna vote for it, we can save a whole lot of time right now. I wasn't for going to full 7,000 and taking all the money from that position. So, we're gonna be seeing that all across the county too, to start doing that. I mean, the auditor can do it now and take that, what's the auditor's entry? 40-some thousand, so we can give each of her employees a $21,000 raise and.
Him.
So.
We
Oh, I
could
think
probably
I just
go to
got
2
one.
commissioners too and cut that down, but
Yeah.
might have a lot of tie votes though.
RNs are, it's specialized and we,
Everybody's gonna come to you at the county saying that their jobs are specialized. I mean, the equipment operators are hard to come by too, so start there, eliminate positions, just take your money and.
well, we have worked with Eric, so.
Get out.
I'm-
The presiding commissioner can make motions too, you know.
Well, I would make a motion that we approve the salary grid as proposed by our Health Department Director.
Second.
Any other questions? All in favor? Aye.
Thank you.
Sorry, no.
I'll bring paper forms.
Chrissy, thanks for getting all this together and your time, answering my questions.
Okay, gosh, look at this. We don't need to get out of here until 10 o'clock. We got 20 minutes we can do. Do we have anything else to come before us?
Yeah, I've got some posters and some cards there for drug take back, safe ways to dispose of your pharmaceuticals and stuff you have at home. There's a site online too. There are 5 or 6 places in Jefferson City. I know the sheriff does it occasionally, but it's not every day. They can just bring them to your office and drop them off, right?
No, our next
Okay.
one's gonna be in May. They're talking about April 22nd was National Drug Take Back Day.
So, and if you go online, there are,
5.
I think there's 6.
Okay, I'll go 6.
I'm just checking my account though. Yeah, there's, there where you can drop them off at. It's all listed online and there's some different things to safely get rid of your pharmaceuticals, so. Posters there if you want to take one with you or any cards, take them with you. I think that was all I had then. I just wanted to share that.
Mr. Commissioner, do you have anything?
I'm a little puzzled about what the next order of business is. I know what we plan to talk about. Are we coming, can we do it under, are we doing it under unfinished business or old business or, because I don't know if we've advertised it correctly.
You talking about central maintenance?
Yes.
It was intended that that not be a public meeting. It just wasn't visitor.
Okay, there's
She's
that.
in the room.
Okay, there's the answer. All right. Yeah.
Oh,
Okay. Okay. Good.
Okay, anything else? Well, our next meeting is April 18th at 9 a.m. I would entertain a motion to stand in recess.
So moved.
second.
All in favor?
Aye.
Here, ma'am.
I had the invite to it, so I thought it was a meeting.